Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Dhiraj Kumar and I'm an assistant professor at KM Hospital. Today we are dwelling into a silent epidemic that India is combating, heart failure. Now in India, you must understand that approximately 1 to 3% people have at any time heart failure. Now the majority of people who are suffering from this disease are surprisingly young. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike in Western countries, where the prevalence maxes out in the sixth or seventh decade, in India, alarmingly, this is affecting people as young as in the fourth and fifth decade. So now let's break down heart failure into 5 essential insights. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they feel that that is the end of their lives. The term heart failure is basically, may seem frightening, but it just simply means that your heart is struggling to pump blood as efficiently as it should. The ejection fraction, which is a metric to measure heart failure, which is normally around 60 to 70%, drops down to below 40%. That's when we call a patient to be suffering from heart failure. Now, what is important to understand is why are so many Indians being affected by heart failure? Well, genetics does play a significant role. Indians are genetically more vulnerable to cardiovascular diseases, especially the devil's trident of hypertension, diabetes, coronary artery disease. Now, adding fuel to this fire is obesity, addictions, and stressful lifestyles, especially which is prevalent in the youth who are living in urban areas. Moving on, what are the signs and symptoms of heart failure? So, first thing is that you must watch out for shortness of breath, fatigue, weakness, and of course, sometimes palpitations, nausea, loss of appetite, vomiting, loss of weight, and confusion. Now, what is important is each patient knows how strong or weak he is in his day-to-day life. For example, if I go walk to my workplace every day, but off late I start noticing that I am short of breath when I walk to my workplace, this is a time that I must get myself evaluated by a doctor. So how can we protect ourselves from this disease? Now, there's a 5-point agenda to protect yourself. First and foremost is practicing stress management, incorporating good, healthy food habits and daily exercise into your routine. Okay. Early detection of heart failure as and when you perceive the symptoms. Most importantly, linking your symptoms with family history. Those who have father, mother, sisters, brothers who have this problem, that is cardiac problem, need to get themselves evaluated at an early age, even after 30s. Now, lastly, what comes next after a heart failure diagnosis? Now, fear not. Thankfully, medical science offers numerous treatment options. And basically, we call it the big 4. We have 4 primary drug options to treat patients with heart failure. And if started in time and if taken properly by the patients, it can lead to an increase in longevity as well as an improvement in quality of life. People can go on working and do not need a change in profession. They can fulfill their social responsibilities as well. Now, for those few who do not actually respond to this medical therapy, there are innumerable, countless procedures which can be done, like implanting a biventricular pacemaker or an implantable cardioverter defibrillator. Sometimes some people need clips in their valves, and of course, heart valve repair. The last option is heart transplant, but that program has also kicked off in India, and you'll be happy to know that every year we are increasing the number of people undergoing transplant by about 10%. Now remember, the lifetime risk of heart failure is 1 in 5 in both men and women, and therefore awareness and proactive measures are key to combating this silent epidemic. Thank you.